Greetings and welcome to this edition of MentorMe Memorable Moments. I'm William Craig III, and I get to serve as your host today because our host, Tracy Everette Duncan, you know her as Ted, is taking the night off. A much-needed rest is what she's getting. So we want to say hello to all 150 nations and all 50 states across these United States. This segment is our mental health segment, and I want to introduce our very own Felicia Jameson.
Hi.
Good evening. We are going to be discussing a very important mental health topic tonight, bipolar disorder. And the reason I wanted to discuss that is that I feel so many people have misunderstandings or make jokes about it. And I really want us to realize this is a serious condition. It's treatable. And we have a wonderful guest here with us tonight, Dr. Leslie Bronner. And she is the head of psychiatry with Duke Regional Hospital. And so we're excited to have her on the set with us tonight.
Yes, indeed. Welcome.
Thank you.
Yeah,
Good to be here.
welcome.
So I can remember when I went through a divorce and when I realized that there were some verbal abusive issues, it made me very depressed.
Okay.
And I went to get counseling because I thought, no, I'm not leaving these thoughts and these feelings inside of me. And the one thing that I did notice is that when I would go to those appointments, I would not see a lot of people that looked like me.
Right.
I would not see a lot of black males there. And so as I have healed and moved on and written the book and doing the radio show, I really wanted to bring this topic out tonight to let people know you can end the shame. You don't have to be embarrassed. If you need to talk to somebody about whether it's depression or whether it's bipolar disorder, you can get help. You know,
Right.
You can be on medication, whatever you need. So that first slide shows various words. And so now we want to begin to talk about how is a person diagnosed. So that's my first question to you, Dr. Bronner. When, we can see people that may have things going on, but now I want to ask you, just guide us in that conversation of how is a person diagnosed with bipolar disorder?
Thank you. It's good to be here. Always good to talk about mental illness. Bipolar disorder is a mental illness. It's a medical problem, and it's one of the mood disorders. And I was just talking with Felicia. One of the mood disorders is what we call unipolar mood, and that is just depression. But we also have bipolar mood disorder. And bipolar consists of manic episodes and depressive episodes. And each one of those things have certain criteria that we use to make the diagnosis. So you would need to be coming to a mental health professional, talking to that person about any signs and symptoms that you might have, and then that person, based on the things that you're telling them, would be able to make the diagnosis. We normally look at things such as whether you're easily distracted, whether you can focus on things. If you're talking to somebody and their eyes are always looking around the room, they don't remember what you're saying, that's one of the characteristic symptoms of bipolar disorder.
So that's one of the key things, just that set of information right there.
Right. So another key symptom is when your mood is excessively elevated. Now, not just when you're feeling good and happy, you're around friends, but we're talking about extreme moods, euphoria. People can get very grandiose. thinking that they can change the world.
Conquer the world, right?
Exactly.
Okay.
So these are the kind of extremes we're talking about, not just feeling good because friends have come over or you got a new job.
Got it.
It's beyond that.
So they swing from one extreme to the other is what I hear
They
you
can
say?
be in a depressive episode and then move on to the manic phase. And so when somebody is in that euphoric state, that gives us some idea that they might have bipolar disorder.
Okay.
The other side of that is irritability.
Okay.
People can be very, very irritable when they get manic. And so, again, it's not the usual irritability, but it's sort of when you get to the level that anything anybody says, they look at you in a certain way, and they can snap your head off, and it can last for days and days at a time.
So it's not just I'm upset. I'm tired and I'm like just cranky. No, wait a minute, don't bother me. It's not that. It goes deeper than that.
And this irritability can lead to fighting. It can lead to people getting into a lot of trouble because they cannot tolerate anything that anybody's saying to them or anything that's going on with them. So that is a major, major symptom that we look for.
So one of the things that puzzles me is this term bipolar has just kind of surfaced over the past few years within our community, if you will. Before that, I used to hear manic depressive. So if you could, is there a difference or is it the same?
It's actually the same.
Okay.
And so the word we use in mental illness is bipolar disorder, but
Okay.
sort of back in the day and what people sort of recognize.
So I'm dating myself is what you're saying. Okay, very well.
Is manic depression.
But William, you bring up a good point because that was another reason why I wanted to discuss it, because so many times people will see somebody acting out or having a difficult time and they just go, they bipolar.
They just throw the bipolar
They
card
just say,
out.
they bipolar. They're crazy. They're bipolar. And I really wanted to give clarity to what it really is.
And the message that I want to get across today is this is a medical illness.
Exactly.
It's not just something that people are throwing around, or you notice somebody's irritable one day, maybe depressed the next. This is a medical illness that we have certain criteria that we use to diagnose it.
Okay.
And there's certain treatments and all of that kind of
And
stuff.
you even have, the ICD-10 codes.
Right, and so
you can
when
get-
Help us understand
So-
what is ICD.
So that is our coding system for making diagnoses in psychiatry.
Okay.
And so when a person comes in and they actually meet the criteria, they'll get that diagnosis, and then there's certain treatments and certain prognoses, etc.
Gotcha.
And even help with insurance payment, because when you can give
A specific code.
right.
Right.
It's not just that she made up something. She has that code.
There's standards of protocol, as
Right.
as the doctor just said. You're not just a blanket manic depressive or bipolar person, but you meet certain criteria that make you have disorder that
There's a specific
identifies right that you have this disorder, and so now this is how we're going to go about treating it.
Right, because you may have irritability, or you may have an elevated mood, or you may only have one or two of those things.
Okay.
That doesn't make you bipolar or manic. That just means you have those symptoms.
So you have to have all three.
Well, there's
Well, there are
multiple
many,
more,
yeah,
but you
but-
have to have 4 out of the 7
Yeah.
in order to get that
Diagnosis.
diagnosis.
Oh, right.
Oh,
So
great
then how do we get
Yes.
to bipolar? Because I hear I hear two, and
right.
polar, night and day.
Right.
And so, but
So
that
the
doesn't
other
seem
piece
to
of
be.
this is an episodic illness.
Mm-hmm.
And so you might have periods where you're manic, and this can last from at least a week. It has to be at least a week, and it can last for weeks or months.
Okay.
Then you go back to your normal self. Then you have a depressive episode that might last some weeks.
These
to
are
Gotcha.
episodes.
And so it's
Gotcha.
the manic phase, and then it's the depressive phase that
Gotcha.
creates the full diagnosis of bipolar
Bipolar,
disorder or
right.
manic depression.
Gotcha. Cool.
Yeah.
So when we look at that, the next thing I want to flow into is how is it treated? Okay, so now the person has the diagnoses. How is it treated? What things are they taking for medicine to help that?
Right. So because there are 2 phases, we start off with medications called mood stabilizers.
Okay.
And things that people may have heard of, lithium, which has been around for a long, long
Yes.
time. Depakote is another sort of common medication that we use. But if you get this diagnosis, most certainly you would probably need to be on a medication.
Okay.
So the mood stabilizers sort of dampen down a lot of this euphoria. Another criteria is excessive amounts of energy. People
Okay.
tend to not sleep at all for days on end, and they tend to get a lot of stuff done. So people kind of like those episodes.
Right. Right.
Oh, okay.
They don't necessarily want us treating that part.
Gotcha.
But the mood stabilizers will allow that to dampen the mood down so that their responses are normal. But also, that also can help the depressive side as well. Because
Okay.
while people like the manic phase, nobody likes the depressive side.
Okay.
And you will have a depressive episode if you are bipolar disorder. So they're the mood stabilizers. And we also use medications, antipsychotic medications. And it's not because you're psychotic, but they also manage mood.
Okay.
So we use things that people may have heard of, Haldol, it's been around for a long,
Yes.
long time, Risperdal, and some
yes.
medications like that we also use for manic depression. And then we also use antidepressants. And so those medications can also be helpful, but for people with bipolar, you would also need to be on a mood stabilizer.
So now, are all of these medication PO meds by mouth, or are some of them injections? How does that work?
So a lot of the medications, the mood stabilizers, the antidepressants, they're usually oral.
Okay.
And a lot of times we have them in liquid forms, and then we have dissolvables. Because sometimes if you get to the point that you are hospitalized, people don't necessarily have the insight that they have an illness, and they don't want to take medications.
Okay.
So sometimes we have to give them dissolvable medications because they don't want to swallow them. We do have injectable antipsychotics that we might have to give
Okay.
against their will sometimes. If,
Really?
Yes, if they don't recognize early on that they have a problem.
Because it can be harmful to themselves and others.
It can be, because another one of the criteria is impulsivity. These
Okay.
people can be very reckless. They can get themselves into a lot of trouble, and that's what usually leads to them coming into the hospital. So they can be out driving recklessly. They can be using a lot of drugs. They can be spending all the money that they have.
Wow.
And usually a family member has to say, there's a problem here, and you need to come in and get some
Right.
help.
That's interesting.
Go ahead.
So with the medication, I was talking to a friend of mine that says that she has to be really careful to encourage, and we're going to flow into some things about the family support, but she was telling me how she has to really make sure that her brother does not drink, and they're like, look, don't start drinking while you're on your meds. Can you speak to that? What happened? Because with him, and everybody's probably different, but what happens to him is when he would start to drink, he would just get real manic, real out of control.
Well, a lot of times, and there's a couple of things that happen when people drink or use any kind of drugs, is that they'll stop their medications because they know that there's an interaction.
Okay.
So if they're using drugs, they may not be taking their meds, and so therefore you're just seeing either the effects of the drug plus the disorder itself. But a lot of these medications can be sedatives, and alcohol is a sedative, and so then you
Right.
can
Okay.
have problems there. Sometimes these medications may cause you to have increased risk of seizures, and sometimes the other medications. So you're sort of having these additive effects of drugs plus the medications.
Sure.
And I think people realize that, so they end up saying, I just took a break from my medication
Oh, just took a
to
break.
be able to
Okay.
use my
Right,
drugs
right.
and not using them together.
Right, right.
Yeah.
I want to go back to something that you said, and there's another thing, so don't let me forget. But here we go. You said most always, and I'm paraphrasing, there's going to be medication involved. Why is that the case?
Well, and that's with bipolar disorder, not necessarily with other mental illness, but bipolar disorder is one of those illnesses that is more genetically determined.
Really?
And so, unlike depression, which sometimes it's reactionary to various stressors in your environment, bipolar disorder has a genetic component. So if you have it, then the likelihood that you need medication is higher. Versus if there's a stressor, and you might be able to manage the stressor, you may not need medications for other
Gotcha.
disorders. But for bipolar, in particular, is one that you probably would need at least a mood stabilizer.
So is there a test that we can take to
Yeah.
to see in our genes that I've got this marker.
Unfortunately not. We're not there yet in mental illness.
Okay.
We are headed in that direction.
Because it goes back to what she was saying, is going through that checklist to see, do you have 4 out of these 7 criteria? So with knowing that that's what you have to do, I don't want to say how quickly, but how long does it normally take for you to be able to identify, okay, you have the 4 out of the 7? Like, how many visits, how many I mean, I know there's probably not a magical number, but I'm just curious, how long does it usually take to confirm, okay,
Well, it
you have bipolar
doesn't take
disorder?
long. If somebody's in a manic episode, you can recognize it pretty
Okay.
easily because they're talking fast. They're rambling on.
I know people like that.
I knew you were going to say that. And I looked over at Dr. Michelle, and she had a look like, okay, ding, 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 I'm identifying somebody. Right.
Yeah, but it's sort of, we've seen so many of these people, and we can just sort of see when we're talking to them that they are exhibiting these symptoms, and we're sort of adding it up in our minds that, okay, they have more than 4 of these criteria. We make the diagnosis, and we hope that we can get them started on medication right there in that first visit.
Wow.
So what causes bipolar? What is the just cause of it?
Well, I mean, we don't have specifics, but like I said, there is a genetic component. So if you notice that there are people in your family that have been diagnosed with bipolar disorder or just a major depressive episode or other kinds of mental illness, you're going to be at increased risk.
Okay.
And then usually stressors come about. So people tend to get mental illness when they go to college, when they go into the military, various transitional stages in their life where they're under undue stress tends to be when these things come
Or
up.
disappointments.
Yeah,
Some
any-
trauma, some
any
nutritional
kind of trauma.
deficiencies, some stress, some emotional, all of the root causes.
All of those things
So-
work together with the genetics to cause you to then have the symptoms.
So they're in the term when people say, I just got pushed over the
Over the
edge.
edge, yeah.
You know,
They were already there.
It was that one thing that finally can
Yeah.
just push a person over into that. So
Yeah.
when we look at all of this, I'm thinking about the role of the family. In your experience, how key is it to have family support, and what is it that the family can do? Because I also know that there are times when people are very resistant to getting on those medications or feeling like I'm not going to be myself, I'm going to be like a zombie. So speak to that for us.
Yeah, the family is very important. And a lot of times we try to have families come into sessions with patients because if a family is on board, the patient tends to be more likely to go down that road because they're going to hear positivity when they get home or when they're interacting with people. But when family is not on board, it's very difficult because, as you say, a lot of times people don't want to be on medications. They're looking for any excuse not to take them. So if your mother or your brother's saying, well, you may not want to do that, you're saying, well, I don't know that I want to do it. I'll get back to you.
Right.
So it's very important that they're on board.
So is that a common thing where the person has the disorder but the family is not supportive or encouraging them, okay, let's go on this journey and you start these meds? There's some family, or what is it that family fear? Could you speak to that?
Well, I mean, I think part of it is that they have a mental illness. A lot of people are scared of medications just in general,
Right.
and so they don't want their family members taking medications. A lot of people don't understand mental illness still, and so they don't want their family member to have it, and so they sort of tell them to shy away from it.
Right. Now, Felicia, you mentioned the fact, and I hear you, Dr. Michelle, you mentioned the fact that when you went and sought counseling, you didn't see people that looked like you. And I think that's part and parcel to the fact that there is still a stigma, at least within the African American community, particularly,
Yes.
around surrounding mental illness.
And even trusting medical providers. And I just know that being able to sit and talk to somebody about what I was feeling at a transition in my life helped so much. That $35 copay, I was like, I'm gonna go get me some help. And I mean, I'm not embarrassed to say that. I mean, look at where I'm at now. I've written a book. I'm doing all of these wonderful things.
2 books.
Yes, thank you. 2 books. I'm an internet radio personality and moving on with life. And it all started where I said, I will not be a statistic. I will go get help. I am not going to just be in a victim's mentality that, my marriage ended, somebody hurt my feelings and get stuck. And so when I saw the wonderful things that happened for my life, that gave me that passion to say, I want to be a certified healing coach. I want people like Dr. Bronner to come on the show and talk about these things. And a lot of times, and the way I deeply got to know her through work was, I'm a wound and skin specialist, and some people, they do the laceration and the slitting of wrists and things like that. So that brought me into that world, seeing more things and saying, people can get better. They can get on meds, and it's treatable. So the family is a key component in helping that person.
Yeah, and what I see nowadays, because as you say, there's a lot of stigma in the African American community and just in general, but as I start to see African American people coming in getting help, they're very surprised
At?
getting the treatment and getting help.
Okay.
They're very surprised that they can get a diagnosis, that they can get medications that work, that they can go to therapy, and that can be helpful. Then they can go back into the community, and hopefully, if they don't feel too bad, be able to tell other people about it.
Right.
I would think that in terms of the relationship to the one that is bipolar and has been diagnosed, that and even in the community, that it will become a holistic situation where the whole family is affected by that one person. So it's very important that the family come into play, everybody in the family, or at least the immediate family, to come to understand the whole situation about the one that has
because
that's depressed.
Exactly.
Yeah,
because like I was sharing a friend of mine,
affects.
she said, I can tell you missed. Did you miss your appointment? You need to go get your meds, because I think she was saying that he took an injection once a month. So that family involvement, like Dr. Michelle is saying, the whole family, because whatever starts happening to that person, the whole family gonna feel it.
And we turn to them to even notice, as you say, when things are not going well. So hopefully we're educating them to sort of recognize another big symptom is that people don't sleep. So if the families notice that they're rambling around at night, they're not getting enough sleep, they're sort of going days and days, they need to be able to call that person's physician and say, there's something going on here.
Good. Yeah.
I'm noticing some of those symptoms that we talked about.
Right.
And that maybe this person's not on medication, the medication's not working anymore, does the dose need to be changed? Something needs to happen for that person to get back on track. And so we do a lot of family education around what is bipolar, what is the illness, what do you need to look out for in order to help this person.
Sure.
But we want everybody around the table so that identified patient doesn't feel like, they're being sort of pushed aside.
Right.
Yeah.
So when you talk about family, how extensive is this? Because we kind of said people just kind of throw out the bipolar card, at the least little hint of bad behavior, right? But how many folks are we looking at, on the average? I mean, in America, what is statistics saying? How many folks are really suffering from this disease?
Well, they say that it's about 3% of the population.
Wow.
Has bipolar disorder.
Really?
So it's a decent number of people.
So it's like 3 million people that we're talking in America.
There's a lot of people that have this disorder. And as I've said, even though people sort of throw it around, some of those people might have the disease and could get treatment.
Right.
Versus sort of saying, so-and-so's in the bad, in our house, and I see all these bad behaviors.
Right.
But can they get treatment and then maybe move on with their life?
Uncle Willie locked in the room upstairs.
Yeah, locked in the room saying all these strange things, not sleeping. I hear him walking around at night.
Right.
Nobody's saying anything.
That. Exactly.
Because that's just how he has been.
Right.
And now we're saying this is actually a diagnosable illness that some people can get treatment for and lead a normal life. People with bipolar disorder can lead a normal life just like anybody else.
Cool.
See, and like you said, it's like they're upstairs, they're in the house, we lock them away, and here again, that's that shame and that embarrassment.
And if they get a diagnosis at 20 years old, they have a whole life ahead
Wow.
of them that they could be missing out on.
So now that brings up another question, of course. How young are we seeing this invading our lives?
Well, and I'm an adult psychiatrist, but we normally see people 20 years old.
Okay.
Early 20s. I mean, that's, like I said, when people start to have the stressors that would bring about and interact with the genetics to show that some of these symptoms are there. So it's when they're in college. You know, I've seen so many people that are starting college or finishing college and have a manic episode, and families are thinking this is the end. My son or daughter does not have a life anymore.
Right.
And then they don't bring them in. They don't get treatment, and it can be because they keep cycling. But we try to tell them in those moments, just get them treatment. Just tell them to take medication. They will do just as well as anybody else.
It's so funny. We're having this conversation. I was looking at a biopic about Gloria Vanderbilt and her son, Anderson Cooper. And Anderson's older brother, well, he has 3 older brothers, but from the same father, that particular brother at the age of, I think it was 23, actually ended his life. And the girlfriend that talked about it, as well as his brother, said that he had an episode, just like you're describing, and but he didn't know what was wrong. And later, about a week later, he apologized. They ran into each other on the street, just so happened. He apologized for his behavior the week prior. But the night before, here we go, probably about another week, the night before, he's crying. He's on the phone with the ex-girlfriend, and he's crying, and he's asking her, can she come over? And she said, well, she said she had a zit, basically, and she didn't want to come over because she had a zit on her face, But here we go. She said, well, can we do it tomorrow? Well, tomorrow was too late because that was the day that he actually ran and jumped off the balcony of the 14th floor of their apartment.
And that's the other side of manic depression, the depression. And people can get into very deep and serious depressions. And Felicia was saying she comes up to the psych ward. I work on an inpatient unit, and a lot of people have tried to commit suicide, cutting their wrists, trying to hang themselves, overdosing on medications. And those are the other reasons that somebody might come into the hospital. But we don't see that side. People reach out or try to reach out, and people don't recognize the signs, and that's when they can get to those points.
Wow.
And the thing that amazed me the most, as I said, I'm a wound and skin specialist, that amazed me the most is how much they will talk to you, that they want to talk. They want to talk to you. And it is that cry for help, and they're there, and they're finally like, I want to talk about this.
Right.
And that was amazing to me, because at first it was like I was in this medical skin wound world, but then, I would talk to Dr. Bronner and some of her staff to say, okay, when I'm in here, is it okay to talk to them? I don't want to go past your treatment plans, but sometimes it was just listening. I saw that they would be very embarrassed about their lacerations, like, why did I do this? What was I thinking? Kind of thing. But still, just being able to talk to them and say, well, this will heal, and we can move past this. This is not the end, to make them feel better about something that they've done that was harmful to their self.
Right.
So, go ahead.
Well, I'm just glad you brought up that issue of listening, because that's one of the probably most important things that we can do for our patients or just family members, listening to what's going on with them versus sort of saying, I see there's a problem, you need to get help. I'm concerned what's going on with you, and allowing them to talk about it and speak about it, because I think people have this idea about what is therapy. Well, that's part of what therapy is having a person coming and sitting and listening to you. And really what people want to be is understood. They want to be acknowledged,
heard,
understood, and accepted for who they are. And that goes a long way towards helping people.
Right.
And
ladies and gentlemen, just want to reset here. You are watching the MentorMe Memorable Moment show, and we're just so fortunate to have, as part of our mental health segment, we have Ms. Felicia Jameson. We have her guest, Dr. Leslie Bronner, who is the managing director, of inpatient psychiatry. medical director, forgive me, for inpatient psychiatry. There it is on the screen to help me out. Thank you, Mike. At Duke Regional Hospital in North Carolina. And we have Dr. Michelle with us. And we are talking about a very important subject, which is bipolar disorder. So as we go into this next half of the show, I did want to ask one other thing about the medication. And that is this medication is something that they will have to take for the rest of their lives, or is it something that they may be able to come off of at some point?
Well, it is a chronic illness, just like diabetes, hypertension. Once you get those diagnoses, these are medications that you would have to take for the rest of your life. So it is a chronic illness. And I think we try to talk to people in the same terms, because if somebody got hypertension, they're not thinking about stopping those medications normally. But a person will ask me, how long do I need to be on this?
Right.
And I say to them, it's just like any other chronic illness, and you would have to take this medication forever.
Wow. So and now I got to tell you, I've heard of diabetes being reversed in some cases, but this is not one of those.
Well, you get better at managing diabetes. Sometimes you might be able to come off medications, but you still got to watch your diet. You still got to exercise.
Sure.
So it's sort of chronic in that you're never going to be able to say, I don't have to deal with this.
I'm
Right.
with
It's
you.
never like I'm cured.
Right.
Right.
But yes, you will have to take medication for bipolar disorder.
Gotcha. Okay. Good to know.
Yes.
So one other shift in conversation, we know what it is, we know how it's treated, we know family involvement, we understand about listening, but one shift I want to make is when it's not bipolar disorder. Dr. Bronner, what is that? When somebody is acting out, is brawls in the family, they don't have 4 of them, they got 1 of them.
Wait,
What's going on?
one every other month.
Right? And good point. I like that. So it's the 4 things, but it's like 1 this month,
Right.
1 the next month.
Right. Rent time, here's another one.
Right. We might not see it for 3 months,
Right.
but then we see another one.
Right.
The 6 month. What is that? What's going on?
Well, a lot of times we hear things like mood swings.
Okay.
People sort of equate mood swings with bipolar disorder. So as you say, some people get very irritable, they get very angry, but it's not something that sort of lasts for weeks at a time. It's,
Okay.
as you say, maybe something related to some event or some reactionary problem. Some people call that and want to call people manic depressive. They're just so manic, they're just so bipolar. But that is more, and it can be related to how you grew up. Poverty, abuse, neglect, poor parenting, all these kinds of things can create a lot of anger and irritability in people. And then they act out, and that is what people are seeing. I mean, sometimes people come in, and one of the biggest rule outs that we have to do is substance abuse.
Okay.
Because you can imagine if you take an upper like cocaine and then you take a downer like alcohol, you're going to be swinging up and down.
Right.
And that's going to look like bipolar disorder or
Gotcha.
a manic episode or a depressive episode.
But that's not what it is.
That's not what it is. And so a lot of times when people come in and they've recently used drugs, I have to say to them, you got to get clean first.
Wow.
Before I can even determine what's going on with you.
Gotcha. So to swing over here for a quick moment, because Dr. Michelle said, hormones and
That could be
menopause and, of course, PMS.
Exactly.
But now from a holistic standpoint, those are some issues that you are able to actually address with some of the things you do. Is that right? So talk to us just kind of briefly about what kind of things you can do for someone who's maybe just having some episodes of mood swings, but they're not manic depressive. I'm sorry, they're not bipolar.
Right. Well, probably things like, first of all, prayer. We definitely have to incorporate prayer in this. And just like we said in the beginning, incorporate the family in getting them educated on what the whole idea of bipolar, period. Medication, if the person has to be on medication for the rest of their life, then in the holistic world, then we would probably have to, first, again, get educated on these medications.
Well, no,
you know?
no, wait. I'm talking about the person who's not bipolar.
Okay, not bipolar.
Yeah, just mood swings.
Okay, just mood
Yeah.
swings.
So what are
Well,
some
that
of the
could
things?
be-
To, you know,
Of your relaxation
Yeah.
Right, so-
therapy.
right.
Okay, well, you didn't say that.
Yeah, I
okay,
did.
you did.
Roll
Okay,
the
I'm
tape
sorry.
back, Mike.
I misunderstood. I'm hanging on to the
It's all
bipolar
right.
person. I'm sorry, William.
That's
Okay,
right.
so what can we do to help that person
yeah,
to
somebody's
stay
got mood swings.
in the
Felicia's crazy
comfortable-
cousins. To just show off every other month.
Well, okay, so again, I'm prayer,
Okay.
exercising.
Okay.
Yeah, prayer's the first thing.
Okay.
We can do some exercising with that person, meditation with that person, change their eating. Food plays a really good part, huge part in
Okay.
that. Things like that. Just making sure that they do easy lifestyle things, reading a book, just making sure that they're calm.
Okay,
and
how about
staying
like
relaxed all the time.
aromatherapy? Is that helpful?
Aromatherapy, and that's situational.
Okay.
Aromatherapy is good. Depends on where they are in their mood swings, I guess. Yeah. And just finding all kinds of ways to just get them to stay calm.
Gotcha.
And
Just
another big thing
just
is
stay
sleep.
calm.
I talk to
Man,
a lot of
sleep is
people
big.
about sleep because
Okay.
people don't get enough of it. And
That would be me.
And that is a great way to keep yourself mentally
Yeah,
healthy
getting
and
them to-
physically healthy. And it is a trigger actually for a manic episode if you're not
Okay.
sleeping. But trying to help people sleep is probably one of the things I talk about most regularly.
Sound therapy is one of the things that I use. So that I know you're gonna ask me what sound therapy is.
No.
But that okay, good. Sound therapy is
Okay.
one of the things that can help the manic
Yeah,
depression.
the ocean
that's
waves
messing with
and
the
white noise.
with the brain waves.
The alphas.
The alphas
Yeah,
and
yeah.
the thetas and the betas, right? Okay, things like that.
One
Yeah, take a
thing-
nice long bath.
And so thinking about, simple mental health tips, physical things to keep yourself calm. One discussion that I had with Dr. Bronner is that, when we have a high pressured job, high paced lifestyle, that when we go home, we need to take it down a couple notches. Like when I go home, I am a nurse.
De-stress.
She's a physician. We don't want to go home and it's like up 4 notches. It's like it needs to come down a couple of notches so that you can get the rest she was speaking about.
Okay.
That I can use my lavender bath salt
So that
and get me
means-
a bubble bath
Yes.
and relax.
So that means you have to set your environment like that in the first place so that you can walk into that environment.
How do you say? Turn out
Yeah,
the
it
lights.
has to be set. And that becomes a lifestyle.
Okay.
That's your lifestyle now. So you have this bipolar individual in the home. So now the family has to make a decision and set the environment where the environment is relaxing, so that when they step into that, that's what it is.
They've got a peaceful
So
environment.
it's right. It becomes a lifestyle.
And
Gotcha.
one favorite saying that I have is pick your battles.
Hmm.
Everything is not something to fight about.
No.
Everybody's different in the home. Everybody thinks different. Have you found any tips or any things that families share with you that makes things easier for them in the home?
Well, I think it starts with sort of education and understanding what's going on with each individual, communication, open lines of listening. I think those are the most important because a lot of times all the family members are coming and going.
Okay.
And if you're not aware of what's going on with you, then you're definitely not going to be aware of what's going on with anybody else.
Right.
And so somebody else's anger turns into your anger, turns into somebody else's anger. And so trying to get on the same page, sitting down to dinner with
That's
people.
what I was going to say. How about we sit down and eat
Sitting down
together?
for a meal or something where people can come together and talk about what's going on because otherwise we're never going to get a handle on this
Right.
problem.
So
Right.
I hear you saying you have to listen with your ears, with your eyes, and with your heart.
Because it's back to that thing. We had a show recently where we were talking about unplug. Get rid of all of this social media, the iPads and the this and that. And let's look at each other. Let's
Come to the
talk
table without the
Right.
cell phone.
Right.
Come together.
Yes.
Right.
Let's talk to each other. Let's
Right.
know what's happening. Let's know what somebody is thinking, and maybe even through just hearing some of your concerns, maybe you can alleviate another layer of stress coming on the person, pushing them over into more of a manic episode or behavior.
So,
Yeah.
Dr. Bronner, based on what Felicia just said, have you seen or is there research that speaks to how this culture that we have created, where we are so insulated with our devices, our personal devices, and not having the interaction, if you will, like back in the day that we used to have? Do you think that that has contributed to the episodes or the episodic events that take place in people's lives?
I think so. I mean, I think we can see over time that there's a lot more negative emotional stuff going on, a lot more problems in families, a lot more problems at work. And it's all these stressors that kick off the mental illness. And we can sort of see that. I mean, there's bullying in schools,
Oh, gosh.
there's suicides,
Bullying
there's
at work.
homicides, right, you know, with adults.
Yeah.
And so we can start to see, and, you know, we have these mass shootings. I mean, there's so much going on in this world that we can see that the disconnect is not allowing people to feel good about themselves. You
Yeah.
can't, if you don't feel good about yourself, then you're not going to be positive. You're going to have a lot of anger, you're going to have a lot of sadness, mental illness, drug abuse, and all the things that go along with that. So it definitely contributes.
And then I think it's important too to teach the family and the individual about self-care, personal self-care, the hygiene. You know, because that plays a really big part in that too. Do you all? Is that what we do too? Is teach them self-care? Yeah. That's
Yeah, I mean,
important.
prevention has got to be at the top of our list.
Yep.
With mental illness. I mean, we can make diagnoses, we have medications, but we would rather not see all of these people in our offices. And so we want to try to support mental health and all the things that go along with that. And part of that is being aware of your emotional state and how you got there. If you are angry when you get home, don't take it out on your spouse. Maybe remember what happened at work and address that problem.
Why
Talk
am I
about it.
angry? Right.
Why am
Talk
I
about
angry?
it.
Because a
Right.
lot of people skip over that, and 3 days later, they're shouting at their child.
Right. And they don't know why.
And they don't know why.
Right.
And the child thinks it's because of them, and the parent doesn't know why. And so you keep moving down the road. So it starts with that awareness. And then, as you say, the self-care. Are you sleeping well? Are you eating well? Are you drinking enough water? I mean, just basic things, because if you don't feel physically good,
That's right.
mental health
Right.
It's
is
not.
not
Gotcha.
far behind.
Exactly.
Gotcha.
And so they all go together. If I'm feeling depressed, then I'm going to start feeling physically bad. And when I feel physically bad, I'm going to start to feel more depressed.
Gotcha.
There was one thing you brought out about, and I guess I would label it as practices in a family, how people communicate or deal with each other. And that's, if I never saw my mom behave in a calm way, then she goes from 0 to, and she doesn't, mommy is so sweet, but if that person goes from 0 to 60 and I see that and then I start mimicking that, so I'm shifting a little bit away from the bipolar just to families that may have those things that's creating a lot of stress just by communication. What's something that we could say or do to help those people to bring it down a notch?
Well, and I think if you're talking about, you know, families with parents and children, it's got to start with the parents recognizing that what they do, not necessarily what they say, are the things that are going to be passed along
Right.
to their kids. So if they tell their child, you know, don't get angry, don't hold on to stuff, but the next day they're yelling at them for unknown reasons, then that's exactly what they're going to do. They're going to go to school, they're going to bully kids, they're going to be angry, they're going to do all the same things that they see,
Right.
and therefore you have now another group of people that are going to pass that on.
Yeah.
And so it is very important inside the home that those things change.
So that message is more is caught than taught.
Right.
Well, you know, 92
Yeah,
to
more is caught than
93% of our communication is nonverbal.
Yeah.
It is. And I think people forget that.
Mm-hmm.
And that is exactly what kids notice.
Mm-hmm.
That's
Yeah.
what they sense. And that's what they start to do. And then when the child is identified at age 5 with behavior problems, I've had
Yes.
people getting kicked out of kindergarten.
Yeah.
Wow.
People don't understand
Yeah.
where that came from.
Right.
Where else could it have come from?
Yes.
Hello, home.
Right.
Right, because
And
they're
so
watching.
then we have an identified patient at age 5 that's going into the mental health system, and nobody's really tracking back to what's going on in the home.
And part of that could
Right.
be as simple as let's talk, let's listen to this person, let's have a conversation that could change some of that behavior. So
And the parents come from their own environments.
Sure.
You know,
Right.
We have
they
our own
may
baggage,
They may have
if you
grown
will.
up in abusive
Right.
households.
It's
They may not have
transgressional.
learned any of those things. And so then to expect them to pass something new on, you know, it really
Right.
doesn't make
Yeah.
sense.
Yeah, that's
Yeah.
They
transgressional.
never learned it.
Yeah,
Right.
change
So
generation.
here we go. Oh gosh, it's a fleeting thought. Go ahead.
I was going to say, is there a certain age where when you start noticing certain behaviors, you might have more of a success rate of correcting some of those things in a child that has witnessed or seen some things? But is there not a magical number, but
No.
is there an age where maybe you can shift some of those behaviors?
Well, I mean, I think the rule of thumb is the earlier the better.
Yeah.
So whatever age is the first 3 years is where most of the interactions that kids learn happen in those first 3 years. People don't recognize when you're 2 and 3 years old, a lot of this stuff is being internalized
Yeah.
and then
Wow.
reinforced by behaviors over time.
Yeah.
And so when you get to 5 years old, people start to sort of wake up and recognize the child when they go to school. But it's 5 years before that
Right.
where so much could have taken place to change
Right.
things. And so when you
That's-
have a child at 5 being kicked out of school, that anger's already there.
Sure.
It's even difficult at that age, but you know, that's early.
And
at
That's
six,
a
they
good
should.
place to start.
Yeah.
Right, because what is it, like 18 months? By 18 months, the child's personality, for the most part, has pretty much developed. They determine what they laugh at, what they cry about,
A
etc.
lot of that
Yes.
stuff comes when you come out of the womb. I mean,
Yeah,
the
it starts from the
temperament
womb.
is there, and the interactions start from day one.
Yeah.
As to how you're going to be interacting with that child. Are
That's
you going to
right.
be listening? Are you going to be trying to understand when that child needs to be fed or to be changed or to? I mean, those small things are important.
I remember now.
By 6
So
they
here we
shaped.
go. When a person is arrested for certain crimes, they are sometimes put on certain lists. For example, sex offenders are put on a sex offender list. With bipolar disorder, is there some sort of registry, if you will, that then puts a person in the limelight, if you will, for the community to say, well, no, maybe this person should not have a gun? You know, does that exist, or is that non-existent at this point?
Well, I mean, part of the issue is, yeah, if you have a true mental illness, no, that does not exist. Most people that have a
Okay.
mental illness tend not to necessarily commit crimes.
Okay.
Now, these people can
Interesting.
be using drugs, they can be doing other things that might get them into the legal system.
Gotcha.
But in terms of just the fact of having a bipolar disorder, no.
Gotcha.
Yeah.
Well, then one of my questions I have is recently in the Carolinas, there was this guy who killed his mom, called the police, and killed his girlfriend. And I know you won't have an exact answer because you didn't do a clinical workup, but I'm just curious, what's going on with these people that, you know, then he picked up the phone and he called the police department and said, I need you to go by my apartment. I killed my mom and go by such and such address. I killed my girlfriend too. And then after they really looked at everything, it came out that he had put his mom's body on ice for a week before he ever called. So I'm like still on, I'm like in the Ask the Doctor segment. What is that? I mean, I know you may not be able to give a definitive exact, but is that a personality disorder, which would be different from bipolar? Like, what is that?
I mean, it can be. I mean, a personality disorder, of course, is the personality that you have, but a lot of people lack empathy, lack an ability to connect with other people, and sometimes that allows them to do these kind of heinous acts and be able to make a phone call and say, guess what? Something happened last night, or I'm sitting with the body, or something along those lines,
Right.
because they're so disconnected.
They're disconnected.
And sometimes that starts early because nobody connected with them.
Got
And
it.
so they never learned how to make those connections. And those things follow them. So then when they get in stressful situations where they either feel this sense of abandonment or feel this sense, the girlfriend may have said to him, I can't come over right now, but I can come in an hour. That may have been a slight to him, to sort of say she doesn't love me anymore.
Right.
Somehow in his mind,
Right.
he twisted that, and that caused him to
Right.
Just
get, sort of come
Oh,
to the edge and go over the edge.
Right.
And so a lot of times these things are developmental.
Do you believe that in our society, in our culture today, that we have become so desensitized because of media, because of entertainment, because of the news, that sometimes that lack is exacerbated because of all of the above?
I think so. I mean, I think that can make whatever's going on with somebody worse.
Wow.
So everybody
Wow.
sort of has
Absolutely.
this sort of underlying issue, and we can either jump in there and go one direction towards mental health, or whatever is going on in the environment causes them to go down the other road.
Exactly.
Because
Gotcha.
just because you come out of an environment that's negative doesn't mean you have to always go down that negative road.
Sure.
It's
There's
still a
always
choice.
opportunities
That's
to jump in there and shift them towards
Sure.
mental health. But
That's
a lot of times those environments don't ever change.
Right.
Wow.
I know we are getting near the
Yeah, about
end.
3.5 minutes. So.
But I do want to just highlight again about parenting and listening to your children, which has been brought out tonight. Teaching your children empathy, teaching them that when you do this, this makes me feel this way, to feel I'm sorry, to communicate those things to a child. I just want to highlight that as we're ending,
Right.
that you could, by those simple acts, prevent that child from doing things where they lack that empathy and cannot care for other people and spread love and kindness.
And on that note, if you yourself feel that you lack in some way the ability to communicate how you're feeling, when you're feeling down, when you're feeling up, if you're, as Dr. Bronner said, having these periods, lasting for a week, where you're just up, and then you notice at the same time you have these periods where you're down, and you're so down. If you are experiencing this, seek help. And on the screen, you have Felicia's information. You can get in touch with her.
And as easy as even going to my website, www.feliciajameson.com. You can even click the Facebook icon on my page, and you will not have to search for me. You will be able to see the shows that we're going to have. And
Great.
we definitely want to be able to bring Dr. Bronner back to discuss
And
some of the
Dr.
things
Bronner's
that-
information, Mike, one more time. There she is, Dr. Leslie Bronner. And so happy to have met you today, to be able to have this conversation. Felicia, thank you so much for bringing Dr. Bronner on the show. And Dr. Michelle, thanks for being here as well. Tracy, this goes out to you. We're hoping that you're feeling better soon. Get some rest, girl. We need you. Okay, and there's Dr. Michelle's information on the screen. So on behalf of everyone here at MentorMe Memorable Moments, we just want you to be safe, be smart, and be healthy. God bless.
Right.
Well, I wear my clothes like this because I can. And I wear my hair like this because I can. And I walk around like this because I can. And I do my thing like this because it's who I am. And if you're expecting me to give you an apology for being nothing that okay, so to you that means I'm all. When I dance to the beat of a drummer you don't hear and you can't see. So if I look offbeat to you, well, the problem must be you, not me. Irregular but never irrelevant.